Transplant surgeons provided chilling testimony regarding the US organ transplant system. They reveal mismanagement, conflicts of interest, lost or missing organs, and unnecessary loss of life. Dr. Robert Cannon, a liver transplant surgeon from Alabama, testified about being asked to procure organs from a breathing patient, which he equated to murder. He claims retaliation for speaking out, raising serious ethical concerns within the organ transplant system.
Anesthetist at the head of the table said they thought the patient breathed, which would essentially negate the declaration of brain death. And what Dr. Karp said, no one really knew what to do. The staff on the ground called their administrator, whose recommendation was, "Oh, I think this is just a brainstem reflex. We recommend you proceed," which of course would have been murder if we had done so. So yes, we closed the patient, we got out of Dodge.
The allegations against the organ transplant system include systemic corruption, thousands of wasted organs, and conflicts of interest. Surgeons report being told to operate on living patients and facing retaliation for speaking out. The Organ Procurement and Transplantation Network, OPTN, is a federally mandated system managing organ distribution in the US, established under the National Organ Transplant Act of 1984. It is supposed to ensure equitable and medically sound organ allocation. The US Department of Health and Human Services, HHS, oversees the OPTN, with the Health Resources and Services Administration, HRSA, managing operations. UNOS has held the contract since 1986, but recent congressional pressure has opened it to competitive bidding. Dr. Seth Karp from Tennessee highlights conflicts of interest within the OPTN and UNOS boards that have remained unchanged for 40 years. He alleges continued deaths due to self-interest and mismanagement, calling for the replacement of the entire OPTN board.
Ensure that HHS appoints a brand new board for the OPTN that does not include even a single person who has contributed to this gross mismanagement. Ensure enforcement of the OPO final rule, which will finally hold OPOs accountable and save lives.
Dr. Jesse Roach from the National Kidney Foundation reports that in 23, over 8,500 kidneys were harvested, but not transplanted due to logistical mismanagement. This equates to 23 wasted kidneys per day, underscoring systemic inefficiencies. A fact-check summary confirms the UNOS monopoly over OPTN since 1986. Congressional and GAO reports cite preventable deaths leading to the 2023 Transplantation Act. A 2-year investigation revealed oversight failures and errors in organ transportation.